I'm Prudence Robertson, and I'm with the Susan B. Anthony List, and today I'm here with Dr. Christina Francis. She's one of our associate scholars at our research arm, the Charlotte Lozier Institute. Dr. Francis, thanks so much for being with us today.
Thank you for having me.
So Dr. Francis, you're an OBGYN doctor, and you're still going to work in the midst of this coronavirus outbreak. So I wanted to start by asking you, how are things going at the hospital?
Yeah, thanks for asking. Thankfully, I'm in the middle of the country, and so thankfully our hospital has not been hit nearly as hard as many hospitals across the country, especially on the coast with COVID, but we certainly have our positives there. We're doing well, delivering lots of babies still. So, that's the one thing. I definitely have job security as an OBGYN because babies will continue to be born despite a global pandemic. So, thankfully we're having healthy outcomes for moms and for babies. But certainly my prayers go out there to the physicians and all of the healthcare and hospital workers across the country, especially in hard hit areas like New York City.
Of course, yeah, now more than ever, we're so thankful for them. Dr. Francis, can you explain what the abortion industry is doing right now at a time when so many Americans are worried about the coronavirus and the health and the well-being of themselves and of their loved ones?
Right. Well, obviously we all know we're being called upon to make extraordinary sacrifices and changes to the way we live our lives in response to this pandemic. And, the reason that most of us are being called to do that is to protect others, to protect those most vulnerable in our society, the elderly and people with health conditions that are at higher risk from this virus. And in the midst of that, in the midst of where I have seen the healthcare industry in general pull together in a way that we've never pulled together before to share resources, to conserve them for where they need to be conserved, the abortion industry has upped their efforts to continue killing unborn children and to continue harming women. They are stating that abortion is essential health care and because of that should be allowed to continue, despite even orders in some states specifically to these abortion clinics that they need to shut down and cease their operations. There's many dangers in doing that. Obviously, those of us that are pro-life oppose abortion because it does end the life of an innocent human being. But in addition to that, they're using up crucial resources that hospitals need: masks, gowns, gloves. In fact, I saw a picture today from a New York City hospital of nurses wearing trash bags as protective gear because they've run out of gowns. And I can't help but think, how many abortion facilities are there out there that are using up gowns every day that these nurses that are on the front lines of this fight against COVID could be using? So they're using up essential resources that are needed by hospitals that are fighting this virus. They're also in their push to expand access to medication abortions. They're also going to increase the number of women that are showing up in emergency rooms because of complications, specifically hemorrhage and infection. And we've heard that this country is facing a critical blood shortage because of people not donating right now because of staying at home. So to intentionally put women in the emergency room that are going to need potentially blood transfusions is just irresponsible during this time. I think the other important thing to emphasize is that they continue to claim that abortion is essential health care, and yet it's not, and they have never been able to prove that it is. Abortion does not treat any sort of disease. Pregnancy is not a disease, and so this is not essential health care. In fact, more than 85% of OBGYNs do not perform abortions. And I don't know of any other component of truly essential health care that is not performed by that amount of OBGYNs. If it was essential health care, it would be performed by all OBGYNs.
Right.
And so, they continue to claim that it's essential health care. And yet, if you look at the guidelines for elective procedures that were put out by the Center for Medicaid Services, for those procedures that are recommended to be suspended during this time, surgical abortions very clearly fall under those elective procedures that should be suspended.
Mm-hmm. Dr. Francis, what are the facts concerning the potential health risks to women who are pregnant and may be exposed to the coronavirus? Can you speak to that?
Sure. Well, I know there's a lot of fear out there by many pregnant women. How is this going to impact my baby? How is this going to impact me? Unfortunately, We don't have a lot of data to work off of. We're, just as everything else with this virus, our information, it seems like, is changing on an hourly basis. But we are collecting more and more reports of pregnant women who have experienced coronavirus and have survived. We don't have a single documented maternal death from coronavirus from all over the world currently. Also, the data that we have that came out of China, they looked at multiple different things to see, is there a risk of what we call vertical transmission? So if mom gets coronavirus, that it could, then her baby could become infected while still in utero. There currently is no evidence whatsoever of vertical transmission from mom to baby. We don't, again, this is based on very small numbers, but we don't have evidence of congenital anomalies if a mother contracts coronavirus in her first trimester. So all of this is very reassuring. If you are out there and you are pregnant and you're listening to this and you're concerned, we do know that pregnant women are at slightly increased risk with any respiratory illness, such as influenza, of having a bit more severe disease. And so certainly if you have symptoms, you need to seek care immediately. But the good news is that with appropriate care, we see that pregnant women are having better outcomes than other people who contract this disease that maybe are older or have other health comorbidities.
That's good. Very encouraging to hear. And just one final question. In your professional opinion, Dr. Francis, has anything occurred during this coronavirus outbreak that might justify rolling back safeguards for women and the unborn that are already put in place?
Absolutely not. If anything, I would say that there is reason for even more regulation and restriction. We know that the abortion industry is notoriously bad at self-regulating, and they're proving that yet again. They claim to be healthcare, and yet they're not behaving as other healthcare entities are behaving. They find themselves, I suppose, to be immune to the recommendations and the regulations that are coming down. So no, there's absolutely no reason to relax restrictions. And again, if anything, they should be increased.
Thank you so much for being with us, Dr. Francis, and thank you for your dedication to the work that you do, and especially in this time. Thank you so much.
Thank you for having me.